I'm going to give everybody a couple minutes to go ahead and join us. I decided to do a Zoom meeting tonight because I have some slides prepared for you guys to share. Go with all the good information. Let's see here. Okay. Hopefully everybody can hear me all right.
I think so. Yeah, it's better.
It's better. Okay, good. I switched to the other Wi-Fi channel, so hopefully that will take care of it, but let me know if I pop out again. So my name is Amy Okofa-Haraye, and my business is called Druggist Healthcare. And my goal is to empower patients and caregivers to improve their health and their well-being. And I appreciate all of you joining me here tonight. If you have any questions about herbal therapy or medications, you can go ahead and post those in the chat box. I am recording this meeting and I will be posting it later on Facebook and Instagram so I can share with my other followers. I'm going to go ahead and share my screen with you guys. See? Okay. And there we go. It's being kind of slow tonight. Okay, so the topic for tonight's video is going to be herbs and supplements for nerve pain. So what is nerve pain? I found that somewhere around 20 to 40 million Americans suffer from some kind of nerve pain. That's a lot of people. It's a lot more common than I thought it was. And people can describe the nerve pain as stabbing or burning, tingling sometimes. Everybody's experience is unique to themselves. And there are a lot of different things that can cause nerve pain, either from an injury, like a car accident or surgery from a procedure. Sometimes nerves get damaged during the procedure. Other things like medications, like chemotherapy, can cause damage to nerves, and also chronic conditions like diabetes or vitamin deficiencies can also cause nerve damage and lead to nerve pain. So treatments for nerve pain, I'm just going to share a few things tonight. The first thing is a healthy diet. Diets that are high in fat can actually contribute to nerve pain. And at the other end of the spectrum, diets that are very restrictive or eliminate all fat can actually cause deficiencies in certain vitamins, also causing nerve pain. So exercise, of course, is good for just about everything. It promotes blood flow, and it also releases your body's natural painkillers. Those are called endorphins. You've probably heard about that somewhere along the way. So exercise can be a good option to help treat nerve pain for patients that it's appropriate for. Oops, go back. Sorry. Lack of sleep, which is kind of ironic. Lack of sleep can make it really hard to cope with nerve pain or other chronic pain. But the ironic part is getting a good night's sleep at night actually can help you cope with pain and alleviate pain. So the two are very much connected. A lot of patients who suffer from chronic pain also suffer from insomnia or other sleep disturbances. Yoga is an option for some people, stretching or other kinds of physical therapy, depending on the source of the nerve pain, can help eliminate and provide relief for some people. Here we go. So the first treatment that I'm going to talk about tonight is, sorry, my mouse is doing what it wants to, is vitamin B12. Like I said earlier, you can have deficiencies in certain vitamins that can cause nerve pain, and vitamin B12 is one of the big ones. A lot of Americans are deficient in this vitamin. Part of it is because of our diets and the choices that we make when we eat. We cannot make vitamin B12. The body doesn't make it. Some vitamins we do, but this one is not. And we can find it in foods like clams, beef, liver, poultry, eggs, milk, and other dairy products are also good sources of vitamin B12. You can get this in a supplement form in the pharmacy. It's pretty readily available, and you can usually get it as part of a vitamin B complex is usually what we recommend for patients, because people tend to not be deficient in just one B vitamin. A lot of times they can be deficient in multiples. So a good vitamin B complex will help replace this in your diet, especially if you don't like to eat things like seafood or clams or liver. Those are not for me, but there are other foods that you can find it in.
Busy checking out the local Montessori school for the new arrival. The one with the empty beer bottles in the sandbox will pass.
So amino acids, there's several amino acids that can be involved in nerve function and nerve pain, and a deficiency in these amino acids can be replaced with supplements. Hi, Kim. I'm going to click here and let Kim in.
This is level.
Here we go. Thanks for joining us, Kim. We're talking about herbs and supplements for nerve pain tonight. Welcome.
Taco night is hard for you can plan for.
So back to amino acids. So L-carnitine, lipoic acid, these have been studied specifically for the treatment of L-carnitine, and they can also help. Sorry, I lost my place there. My computer screen went crazy. They have been studied and found to be helpful in the treatment of peripheral neuropathy because they have anti-inflammatory properties. Omega-3 fatty acids, which you probably have heard are good for your heart, are also good at reducing inflammation. And they've been found to relate pain, especially that has been caused by chemotherapy. Oh, that's okay, Kim. Glad you could join us. If you have any questions, go ahead and please post them in the comments, and then I will answer and take questions at the end. Try and get to everybody. Get that. Okay, so omega-3s are the last of the amino acids. Again, this is another supplement that you can get in the pharmacy. It's also available by prescription, and sometimes we use it to help treat high cholesterol as well. So those omega-3 fatty acids that are found in fish and seafoods can be really good for your health and well-being if you enjoy eating seafood. Okay. The next one I'm going to talk about is curcumin. This is the active ingredient in turmeric. It's used to treat pain. It's been studied for rheumatoid arthritis and nerve pain and found to really be effective at reducing both of those. It has both antioxidant and anti-inflammatory properties, and it can actually act as a neuroprotective agent. So the thing is with curcumin, if you've ever eaten a curry, you've probably gotten some of it in your food in the form of turmeric, but that's what gives the food its bright yellow color. There's also green turmeric as well. Lots of different varieties there. But the problem with turmeric is for it to be effective, you actually have to, have to consume quite a large amount of curcumin in your foods, and that's kind of a challenge unless you're eating a diet that's really rich in these foods. So some people choose, instead of eating it, to go ahead and purchase a supplement. And with any supplements, you want to make sure that what you're purchasing is high quality and well manufactured, so that you're not purchasing something that says it's something that it really actually isn't. Because unfortunately, natural products and supplements are not as regulated as prescription medications in our country. So it's something you need to be careful of. And this supplement can also have some drug interactions with other medications. So if you're thinking about this one, it's important to ask your pharmacist or your provider if you're taking any medications right now that could be an issue with this drug or supplement. It's a food drug. The last one I'm going to talk about a little bit here. Move. Okay, so over the other side. There we go. Is CBD, or cannabidiol. So this is not the component from marijuana that gets you high. That is THC. THC is the component in marijuana that is psychoactive. So there is some misinformation or confusion out there about what CBD is. So yes, it does come from the same plant. It comes from hemp. But it has been used for thousands of years for its anti-inflammatory properties. And it has also been researched for pain relief, for nerve pain, and found to be very beneficial, especially for patients with chronic pain. So this could be potentially another option for patients for treatment. Okay. So I'm going to wrap up here a little bit. Okay. So to summarize, I know I went over quite a few things. Treatment for chronic nerve pain can be really very difficult, and it depends a lot on what was the source of the injury in the first place. So if you have a patient who is suffering from diabetes, then the first thing that needs to happen is if their blood sugar is out of control, then that's what needs to be addressed first. So the supplements and things can help provide relief for patients. But if there's an underlying injury, then, or cause, like your diet or lack of exercise, high blood sugar, those kinds of things have to be addressed before you're really going to get a lot of benefit from any kind of supplement. So supplements are wonderful and they can help provide a lot of relief for patients, but they definitely are not going to fix everything about your health and wellness. So a holistic approach using, like it says on the side, supplements along with diet and exercise can really help to give the patient the best result and get some relief from their pain. I'm gonna turn off my screen. There we go. Okay. So I went over several different supplements. Does anybody have any questions tonight about any of those that I went over, or any other questions that you guys would like for me to address? I'm also taking suggestions for topics or requests if you guys have any ideas.
Is there a form of CBD or any of these other supplements that should be taken in one form or another? I know I was looking at like CBD creams for nerve pain versus like by mouth methods. Is there one over the other?
I would say it depends a little bit. I've looked at both. The oral supplements are nice, especially if sometimes stress and anxiety can contribute to chronic pain. Like I said before, insomnia, chronic stress, chronic pain, all of these things are very much linked together. to one extent. So if you have some of those other things going on, then I think the by mouth is a good solution. For some patients, they might just feel more comfortable taking like a topical product because, with the history and the source of CBD oil, some people are still kind of hesitant to just take it orally. I have seen some products out there that are high quality topical products that people get a lot of relief from. And, if you're looking for just like a one spot, like if it's just your hip or just your feet, then I think a topical product is fine. But if you need something like if you're more, like if you had arthritis or something where it's more widespread, then you're going to end up using a lot of cream. And most of the high quality products can be really pretty expensive. So I think it becomes not very economical at that point to use the cream, if that makes sense.
Yeah, it does. I I have a like really bad stress and anxiety and the whole 9 yards, and I've been living with chronic pain for a while, and I went into a CBD store and I got like really overwhelmed looking at everything. And I was like, oh, there's so much stuff.
There
it's
is
very helpful, actually. Thank you.
Have you tried it yet?
I tried a cream once that my mom had, and I really liked it. But other than that, I haven't.
Yeah, they are the high quality products I've seen so far are pretty pricey. So that's why I would consider, if you have, like I said, some of those other things. Like I personally also have dealt with anxiety. Some days it's better, some days it's worse. Like today it's pretty good. But the CBD has calming properties as well that can benefit those issues, so you can kind of get more benefit versus a cream. It's you're not going to get a lot of absorption into your body if you apply it to the skin. So you're going to get some, but probably not enough to help like widespread. But yeah, there's a lot of interesting articles out there on CBD.
My other question is, you mentioned finding the source of chronic pain to like find out what like supplement and vitamins and things would help best. How would you recommend going about that? Just out of like curiosity.
Well, whenever I'm working with a patient, you kind of are going to start with kind of a general, overall like health assessment. So if it's diabetic nerve pain, then it's pretty straightforward, and that the source is probably uncontrolled blood sugar. If it's chronic pain, it could be from lifestyle choices. So you just want to start by evaluating overall the health situation. So how is your diet? How is your exercise? How are you sleeping? If you're suffering from insomnia, you're more likely to experience chronic pain. Like I said, they're both linked very highly. We don't know 100% whether things like chronic insomnia contribute to chronic pain or vice versa, but we also know that depression and anxiety are wrapped up in there too. So if somebody has a specific injury, whether it's from a surgery, then maybe the appropriate thing would be physical therapy, stretching, maybe some yoga. They could try either like a CBD topical. There's some other products topical I didn't talk about tonight, like capsaicin, that's good for muscle strain and sprain. Chronic pain sometimes doesn't necessarily always have a source that you can pinpoint. Sometimes you're looking at something that's more like fibromyalgia or from stress, or it could be an old injury that happened, many years ago. So we kind of just start with like an overview, like a global systems, and then based on the information you get, you narrow it down into smaller and smaller groups until you can kind of get more of a target on it. The more idea you can get about what could be contributing the pain, it makes it easier to find treatment options that are going to be, you know, more effective for that person.
Thank you.
Oh, you're
That's
very welcome.
very helpful.
I appreciate you joining me tonight. Do you go by Cookie or Kim? Is she still here? Maybe. Okay. I'm not sure if she's still in the room tonight, and I'm sorry. Oh, your real name is Cookie. It sounds like Cookie. Okay, thank you. I don't want to mispronounce your name. My last name is very long. Everybody always messes it up, but yeah, welcome tonight. Okay. Well, I don't want to keep you guys up too late tonight. I know everybody has lots to do. If you guys think of something else that you would like or other topics you would like to hear from a pharmacist about, check out my Facebook page. I just joined Instagram today. I'm really late to that party, but I'm going to give it a go. Let me know or post a question, and I hope you liked it. Hope it's beneficial. And if I can help you out with something else, please let me know. You guys have a great night.
Thank you.